Dr. Hosley. How are you today?
Just lovely. How are you?
I'm doing well, thank you. So you are a primary care nurse practitioner,
Yes.
and you also are a specialty track director. Can you talk about both roles and what you do in both roles and why you like doing it?
On the clinical side, I am a nurse practitioner in a complex healthcare clinic that serves as a primary care or medical home to children with neurodevelopmental disorders.
Okay.
So just like a child that does not have any significant neurologic medical history goes to the pediatrician for a well child exam or an ear infection, our patients come to us with the same things. They just have a few more people on their team, right? So instead of just the pediatrician, they may have neurology or GI. And so we help them to navigate where they need to go when, and serve as that in-between when everybody needs to communicate. But overall, our place is to serve as a medical home for those patients so that they have that traditional pediatric experience as well. And then on the academic side, I enjoy teaching and helping to prepare other nurse practitioners.
Okay, so I have a few questions for you. What are some effective strategies for educating parents and caregivers when they have children who have neurodevelopmental disorders, or how do you work with them to develop treatment plans? You mentioned that there may be more people on their team when they come and see you, so what's your approach in being able to work with the families?
I think the key to what you just asked was how do you work with the families and know that we are not just giving them a treatment plan. In order to educate them, you have to listen first. Listen to what their goals are for care. Listen to what their needs are as a family and also what their challenges are as a family. We can write out a wonderful plan of care that involves them doing this 3 times a day and give them that 2 times a day. And if we come from that perspective, we haven't taken into account the fact that they are parents to other children.
Yes.
That they have to work. They might want to cook dinner every once in a while. And so sometimes those plans don't work. And so in order to educate them on what we think they should do, we have to listen to what they need first. So I think that would be the number one thing, would be to listen and develop that plan of care and education with them and not for them.
So you leverage your education and you utilize your knowledge of the industry that you're in, but you also tailor it to the specific family.
Exactly.
Okay, and so in terms of like success stories, what has been, how has that approach been helpful in ensuring that families are able to manage well and to be able to support their children?
Success stories. I think a success story would be when you have developed a plan for a patient that was having previous challenges, say with the child gaining weight, if they're dependent on medical technology to gain weight. And so a family may have difficulty meeting those needs. And so a success story would be working with the entire team, so not just those parts of the team in complex healthcare, but if they're hospitalized, working with them and then continuing to educate and check in with them when they come home. Not to say, oh, you didn't do this, now you have to do this, but supporting them on, you did this better.
Yes.
How can we help you to remember to do this next time? And then you check with them the next week. How did that work? Do we need to adjust it? Tell me how I can help. And so the success story would be in that instance to see that child start to gain the appropriate weight at the appropriate time.
But it all goes back to your approach in working with the families. Yes.
Right.
So that's very intriguing. Okay, so you also mentioned not only are you doing this clinical work, but you're also teaching. How do you leverage your clinical experience and your expertise in your teaching style with the students who are essentially going to be the future yous in being able to do the work that you're doing while being able to work with different families and being able to do things that support children at large?
Well, my experiences in the clinical setting are what prompted me to come back to teach.
Okay.
Just because of the things that we see, and we can educate and help so many more families if we're teaching here in the college versus precepting one student at a time. And so it's important to me that we translate what's actually happening. So in healthcare, we talk about evidence-based care all the time, right?
Right.
And so instead of just having them read the books, being able to take what we're doing and how we are applying the care and what we're seeing come from it, and being able to use that as an example in the classroom. When you finish reading this chapter, let's have a discussion. What did you see in your clinical setting? Well, this is what I've experienced in the past. How might this change what you do? Or tell me your thoughts about this. So it has to go together, because you can't have each of them in isolation. You can't teach without knowing what's going on in the clinical setting, and you can't exist in the clinical setting without trying to improve the education and what's coming next, like looking to solve the problems that you all are solving with your research. So they have to go together.
I like that. And it's very fascinating you being able to combine both the clinical as well as the academia, but not just being able to do it from a structured step-by-step, but more so a mentorship. What would you say in terms of like your best students so far, like the things that they're doing now, and and what are they doing in their careers now?
It's like a mom. You never have a favorite child. You never have a favorite student. But I have one particular student that I've had the pleasure of keeping in touch with over time, and she is about to wrap up her PhD in nursing, and may at some point in time, whenever there's the right time, come back to potentially think about a DNP as well. But right now she's happy with the PhD, and so that was to watch her through that, and to know that she still calls me from time to time and asks me certain things. It's nice to know that relationship is ongoing. So yeah.
Absolutely, because you truly are making a difference in both the clinical setting and in the classroom, and to see whether families or students be able to have that rapport with you is affirming the fact that you're doing the things that you need to do, and it truly is a calling. So
can I add something to that, though?
Sure.
Just from the perspective of anybody that might be watching it, our success stories are not those that all go on to graduate school. Sometimes our success stories are the ones that had a misstep, took some time off, came back, and still finished. That success sometimes is even more important than the one who was able to go straight through, because they had the resilience to come back and know that they still had something to contribute. They could let that go and come back and try again. So I think those students are probably my favorites, the ones that come back and say, I'm going to get this.
I like that a lot, and that also speaks to the fact that it's never too late. And you can always continue, you can always try again. And even when we're faced with clinical challenges, or if we have healthcare challenges, and for example, trying to lose weight, that might be a challenge, and somebody might have several stumbling blocks with wanting to do that. But if they never give up and they're able to continue to have this resilience and this persistence to keep trying, eventually they'll reach their goals. And I'm sure that it also adds to wanting to be mentored and taught by you. So, yeah, absolutely.
And I can be mentored and taught by Dr. Breitenstein as well.
Yes.
Well, we all work together really closely, which is really great.
Yes.
It's a good place to be.